We think the best thing for you to do is to have an amputation.
Around 4 million people in the UK have type 2 diabetes.
We need to talk about this to decide what to do.
It's mostly preventable, but it can be deadly.
It slowly came on, you see.
The trigger, bad diet and lack of exercise.
4:30, going for more chocolate.
The result, all too often,
there's a blockage in the artery.
heart failure, kidney disease, feet and legs that must be amputated.
Say yes to me when I'm touching your feet. Nothing? No, okay.
So I will just cut it, leave it open.
I will have performed 2 amputations alone today.
It's an invisible illness and it basically rots your organs from the inside.
It used to be a disease of the middle-aged and elderly.
How old are you now then, Amit?
15.
He's got a whole lifetime ahead of him with diabetes.
Just as the disease slowly grips a patient, the costs are slowly strangling the NHS.
We are in a crisis now.
Panorama has spent 6 months at the sharp end of the battle against this rising epidemic.
We are very much putting out the fires, and whilst that is my job to do that, I would very much wish that these fires didn't exist in the first place.
Type 1 diabetes, the sort you're born with, accounts for just 1/10 of cases. It's type 2, mostly brought on by lifestyle, that's now flooding Heartlands Hospital with new patients. Birmingham has one of the highest levels of diabetes in the UK. An estimated 1 in 10 people here has it. The hospital has spent £6 million building a dedicated centre to cope with the diabetes epidemic.
This is our main reception area where patients come in. We see about 8,000 to 9,000 patients every year. We deal with a huge range of problems resulting from diabetes. Patients with damage to their nerves in the feet, patients requiring regular dialysis, patients having severe eye disease.
Keep looking there.
The prevalence of diabetes is increasing so rapidly that it is 3 times the number of all the cancers combined together.
9 out of 10 type 2 diabetes patients are overweight or obese. But diabetics don't just face the risk of amputations. Sharon Barnett is 44. She was diagnosed with type 2 9 years ago. She is worried about the damage the disease might be causing her eyes, kidneys, or heart.
Hello.
You can stop the disease progressing if you lose enough weight and change your lifestyle. But Sharon has tried many times and still weighs 18 stone. In 3 weeks, she will have weight loss or bariatric surgery. She's here for a pre-op check. The growing burden of type 2 diabetes is having a big impact right across Heartlands Hospital.
Diabetes just ravages most of the systems. It has effects on the heart, has effects on the blood vessels, has effects on the kidneys, and it's just non-remitting, non-relenting, you know, it just carries on. At the back of your mind, you always think that they have a limited lifespan because there's only so much you'll be able to do for them.
If you've got type 2 diabetes, you're almost twice as likely to have a heart attack and over 3 times as likely to have kidney disease.
How are you getting on with the dialysis? You all right? Any problems, the fistula or anything?
We probably get about 10 to 12 referrals a week. Probably 5 of them, 5 or 6 will be type 2 diabetic. About 40% of our patients on dialysis are type 2 diabetic.
Annette visits patients at home to explain what lies ahead when they need kidney dialysis to keep them alive.
It's quite difficult walking into somebody's house and they don't know what you're going to tell them. They're terrified. But at the end of the day, unfortunately, the story is the same. really, that you're going to need to have dialysis, and this is what it entails. The whole life now is going to be monopolised by the renal failure.
Annette's next visit is to John Jameson, but the type 2 epidemic is now affecting people much earlier in life. Just 16 years ago, there had never been a single case of a child being diagnosed with type 2 diabetes in the UK.
I didn't quite believe it. It wasn't in any of our medical textbooks. We didn't get taught it in medical school, so we didn't expect to see it as an issue. We just didn't think we thought it was an American problem. But in the year 2000, we saw the first cases in the UK, here in Birmingham.
There are now over 500 children in the UK diagnosed with type 2 diabetes, and the number of new cases is rising alarmingly fast. Every new diagnosis of type 2 diabetes in children has been analysed by Amir's doctor and academic colleagues.
It was August last year, so he would have been 15.
Definitely got diabetes with the random glucose.
We're seeing twice as many children developing type 2 diabetes than we were in 2004-05. A striking number of the children have evidence of fatty infiltration of their liver and abnormal liver function tests.
11-year-old, 12-year-old.
I saw a child last week who's actually developing cirrhosis of the liver. Type 2 diabetes in children may be a different disease to type 2 diabetes in adults. So adults who get this at the age of 50 or whatever may not necessarily get these other complications. But the children we're seeing with type 2 seem to have got a more aggressive progress, and they're getting these complications earlier than you would expect.
As greater numbers of children are being diagnosed with type 2, the financial implications for the NHS in the future are grave.